Hi and welcome to my channel. So there's been a lot of speculation regarding the UK recruitment of overseas workers, regarding the skilled worker visa, the health and care worker visa, and most especially the UK carer visa. Is the UK still recruiting carers? Are they going to continue recruiting carers? What can we expect from 2024? So there is an update from the UK government and Honorable Prime Minister Mr. Rishi Sunak. So in today's video, I'm going to be talking about what these updates are, what the expectations, we can all have really going forward into 2024. Because as you know, these are the final few days of 2023, and it's a time to reflect on your own goals, what's happened this year, and the government is doing the same. So they've provided a lot of information regarding the health and care worker visa, the skilled worker visa, and the government's plans going forward into 2024. So if you're new to my channel, obviously you're welcome. If you are a returning subscriber, I appreciate your time and I hope that you're finding this information helpful. The reason I share these details is so that it can help you with your decision making. If you're currently planning to come to the UK, if you were planning to move this year and you haven't moved, what happened? If you did move to the UK this year, welcome to this beautiful country. Congratulations. And, all hope is not lost. So again, if you haven't subscribed to this channel, you want to join the family now, hit the subscribe button so you're the first person to be notified every single day when I drop a new video on here. Before I get started, let me set the pace. So the government has officially given the numbers of people that have moved to the UK and set their plans for 2024. So how many carers, nurses, and all professionals moved to the UK in 2023? So you will be glad to know that for this year, 120,000, which is a massive number, 120,300 people moved to the UK on the health and care worker visa. So that is an increase, but like 6x increase from 2022, which means that in 2022, 12,000 people moved to the UK on the health and care worker visa, which was like literally nothing. But then this year alone, we've had 120,300. And carers, very interestingly, make 77,000 people from that number. So as you can see, 77,000 carers have basically moved to the UK in the last year alone. So I do have a free newsletter, by the way. I've dropped the link in the comment section below where I share information about free visa sponsorship opportunities to move to the UK. So you're not spending thousands of pounds, you're not getting bankrupt to come to this country and actually not even get a job. I also share information about, career progression opportunities in the UK. If you're a nurse, you're a carer, you're getting into healthcare, you're looking for apprenticeships to study in this beautiful country without spending millions and thousands of money. I also share info about work from home jobs that you can do to supplement your income, as well as side business ideas that you can get started with in order to gain that independence and leave the rat race. Because look, I'm on a mission to retire by the time I turn 40. It is my wish that when I turn 40, if I'm still working, it should be my choice, not because I'm broke. And so I put in a lot of effort in various side hustles, work from home jobs, so that I can earn extra income, have huge amounts in savings, and be able to invest in ventures that are going to earn me a passive income. As I'm aging, I'm working less and earning a lot more. So if you're interested in any of these things that I've mentioned, you do want to join my newsletter, which is completely free. I send that info directly to you. If you're also keen on getting in contact with me, you're going to see my contacts on there. Obviously, there's my WhatsApp number and you've got my email address. So do feel free, obviously, to reach out. And so, like I was saying, what is happening? In fact, one of the ministers, one of the government ministers has said that these carer visa, for example, needs to end. There should be an end to the carer visa. There is a big part of the government that is against the carer visa, not because they don't want people working here, but because of the numbers that are coming. Because if you look at the fact that 12,300 people came in 2022, and then this year we've had 77,000 people, that's a 6x increase, which is a lot. So what the minister is saying is we need to find other measures, other strategies in order to employ people that are already in the UK. One of the things that the government has done actually this year is to introduce BTEC courses for people in the UK so that do those courses, get qualifications in health and social care, and then take on those healthcare jobs. But they've also introduced apprenticeships to encourage people in the UK to take on those jobs so that they will reduce reliance on overseas workers. But obviously, these are things that are going to take time to be able to take effect, because for somebody to study, say, an apprenticeship for nursing or whatever it is, it's going to take 3 years before they can qualify. And so it will take years in order to build up those numbers. So that's one thing that they are doing. By the way, if you're watching this and you're wondering who I am, so my name's Melvis. I currently work as an advanced nurse practitioner here. I work for the NHS here in England. I'm very passionate about these jobs, these opportunities, because this is how I started my own journey. I started as a 20-year-old working as a carer in a nursing home. And then I remember at the time I was earning 16,000, which was ridiculously low. I was like, oh my goodness, this is not sustainable. So I decided to study nursing in the UK as an international student, graduated, from there I've progressed beautifully to now the most senior clinical nursing position. I have a private career coaching program where I support with career progression in the UK. I've dropped a link in the description box, or check out the about section of this channel, and you get that individualized, personalized, tailored, and one-to-one guidance with getting free visa sponsorship opportunities. It's not an easy option, but it is getting that hand holding, that support that you need, that accountability that you need with that journey. And so if you're part of the top 1%, because the people who join my coaching program are only part of the creme de la creme, like I call them, and the top 1% of people who are heavily invested in their own personal and professional development, then you get that, tailored, individualized guidance. We have weekly live sessions. You will be getting that support from like-minded individuals, success-driven people that are going to motivate you, to encourage you, to make sure that you don't only talk about what you want to achieve, but you actively work towards achieving it. If you're keen on getting into healthcare, then also that program is for you. You're looking for apprenticeships, to study in the UK for free, while being paid for the pleasure of it. That's how I've studied, in the UK ever since I found out about apprenticeships myself. You're looking for, work from home jobs, starting your own side hustle. What can you do in this country? How can you supplement your income? How can you make the most of the best opportunities? That's what the program is all about. So again, check it out and do join us. And by the way, if you're enjoying this content, I want you to hit the like button. It lets me know you enjoy content like this, and obviously I should do more. So again, we're talking about an update regarding the UK carer visa and some of the strategies that the government is implementing to make sure that the UK has the cover when it comes to healthcare workers. But something interesting is there as well, because the UK, at the same time, even though they've recruited so many people in the sector, they also have 189 vacancies still outstanding as we speak, which means that although they've recruited so many people, many others have left as well. And the reason for this is that the pay for carers in the UK is incredibly low. So £20,000 per year is not enough. And that's why I'm a huge advocate getting these carer jobs, but I'm also an advocate for career progression. The fact that, yes, you get this job is a stepping stone, it gets you into the room, into the building, but look, you need to be wise, smart, make use of the opportunities around you so you can progress, push forward, earn more, and be able to live better. Because £20,000 per year is not going to make it in the UK. It will not make you live any, like, it is not enough basically. And you're going to be struggling a lot, but it is a stepping stone. That's how I normally see it. That's how I call it. And that's why I encourage it, but I say look beyond that once you get it. It's step one, but there's more steps you need to take once you get through that first step. So that's what it is. Because of these vacancies, obviously, they've basically got no choice than keep recruiting, because the people that own the nursing homes, the NHS hospitals, have said we cannot do without overseas staff. We must have overseas staff. We must continue to recruit overseas. Otherwise, it will be impossible to run these nursing homes, to manage these nursing homes, to offer that, personalized and that holistic care that the people rightfully so deserve. And talking about that, obviously, there are people that are staying in hospital for like a year. I was watching on the news the other day, and people have been in hospital for 10 months because they don't have carers in the community to care for them out there. So by default, they cannot be discharged home and they end up staying in hospital. So because of these measures, the government has really been pushed to keep recruiting overseas, even though, like I've said, there are ministers who are strongly against overseas recruitment. And in case you're not aware as well, the UK is currently being led by a conservative government. One of the biggest things about the Conservative Party is that they are out to reduce net migration. That's a big part of their manifesto, which means that they want more people leaving the UK than people are coming into the UK. But that hasn't happened because net migration has increased significantly because more overseas people have moved with the health and care worker visa. Like we said, 120,000 people moved just in 1 year. If you think about how many dependents they've brought on these visas, it's probably double or more. And if you think about the student visas, the fact that they've also skyrocketed, then obviously net migration is a lot higher than they would like it to be. And with a general election in the UK looming not very far from now, we can expect that this is the reason why the government is trying to do everything possible to reduce the number of people coming into the UK. That is really the main target that they have. It's just that when it comes to health and social care, it is something that they need because it affects people directly. Which is why when it comes to the student visas, from January of 2024, many students coming to the UK will not be able to bring their dependents because the government is hoping, therefore, that when they reduce the number of students bringing dependents, they will see how this affects the net migration, and then they'll be able to decide whether the carer visa or the health and care worker visa can continue, or can they reduce the numbers and put a cap. Because interestingly, some of the ministers are saying, yes, we understand that we need to be recruiting carers from overseas, nurses, doctors, but actually, we need to put a cap on how many people can recruit a year because currently there is no cap. And that is why these jobs are on the shortage occupation list. So as you can see, there are many things to consider. There are so many complexities. When you look at the skilled worker visa as well, in the last year, 189,000 people moved to the UK on the skilled worker visa. Again, that's a lot of people. If you think about how many dependents people brought in, it's very high. So all these things help to put up the numbers for the net migration. So, the government's concerned basically, but I think that they are very stuck. They're found in a very difficult situation because the pay for carers is very low, which means that people in the UK don't necessarily want to do it or they don't stay long in the job. By default, they are reliant on overseas staff, but at the same time, they don't want overseas staff because it's increasing the net migration, which they want to keep low. And so it's like a yo-yo situation where it's like, what do we do? How do we balance all of this? What can we expect from all of this? And it's really, really difficult. But the official thing is they will have to continue recruiting. In fact, one of the ministers a few days ago was doing an interview, and he was strongly for the fact that they should stop recruiting overseas carers because the numbers are ridiculously high and it makes no sense. And he was asked who will replace the carers that are coming from overseas, and he said that he will simply encourage people in the UK to have more kids because then there'll be more people that can take over and do those jobs. And I was thinking, yes, if you have more kids, that's all good and fine. But how long will it take for those kids to grow in order to take on those jobs? It's going to be forever. So again, these are some of the things that I'm thinking about. These are some of the the topics that they're pondering on. But as for now, there's no choice but to continue recruitment of overseas workers into these essential jobs, into these life-changing jobs, because if you don't have healthcare workers, the UK is going to be in, like, it's going to be crazy, because despite the high levels of recruitment, the shortage is still very, very acute. And the fact that we're moving into the winter, the recruitment is only going to increase because the winter months are very challenging in the UK. They open new hospitals, new wards, new areas to care for people. So there is a lot. What do you think about all of these opportunities? What do you think, by the way, are the three highest countries from where they recruited carers? What are the three highest countries from where the UK actually recruited carers in the last year? Because now you know that 77 carers were recruited. So again, if you haven't subscribed to this channel, do hit the subscribe button. so that you're the first to be notified when I drop a video on here. But if you need that tailored guidance, consider joining my private coaching program, which I've dropped a link in the description box, or check out the about section of this channel. Do check out this other video that I've linked up specially for you. I'll see you here.